all the abdominal viscera will be there, not the pelvic organs. Okay, even the pelvic organs, uterus. So you all have to see it yourself, because I told you earlier, even other teachers told you, the liver, even just now, Professor Roy was telling me that you had an exam, I think. Okay. Now, in that exam, your performance was not very good, whatever it is. So, you have to see it. A test is on a hydrocele, small hydrocele we operated, and the version of sac and the cleft epididymis, the torsion, you just please share it. But main structures, the gallbladder fossa, the quadrate lobe, your these you have not answered properly. I told you earlier, whenever I'm telling you something, I'm telling you the main gross features. I told you that that will give you 60% or 50%. But if you want to go for a gold medal, honors and all, then you have to know it. You have to know it even if you want to pass. If you become blank in the script and also blank when you are replying for Viva, you take care of yourself, please. You cannot, because 8 months, practically 8 months you are having a 1 year's course with 8 months only. 4 months is gone for everything. Some latecomers are there. It's not their fault. Their counseling and all this that's going in. But the exams, they don't get any priority. You please, I will be putting all these specimens of the abdomen. There are stools. You don't crowd, you just be in batches and see it, feel it. So transverse colon, ascending colon, your this is the appendix. Now you put it like this. Now you just now see. Imagine this is the abdominal cavity. Just imagine, it's a cavity. Okay. Now this is the cecum. This is the ascending colon. This is the transverse colon, the descending colon, pelvic colon, rectum, anal canal. Okay. Now, why I am saying that this is the cecum? Because this is the ileum. Ileocecal valve is here. The appendix is here. This is the appendix. Yeah. This is the fat. This is the mesoappendix. Okay. This is descending colon. Ascending colon. Right colic flexure. Left colic flexure. Descending colon. Pelvic colon. Rectum, anal canal. First, now see, now these are the longitudinal muscles. This. And like when in operation, during operation, you are making a small incision. First of all, you try to feel the ileum. Now, don't take out the ileum like this. Then it will be so long. You will mess up everything. Mess up means I am saying, then you will not finding it. So you just go and slowly you feel this. Then you go to the cecum and you see these muscles. This lift up the cecum. Sometimes cecum is fixed to the posterior abdominal wall. It can happen. So don't, you have to gentle handling. You slowly, then you try to bring and you see, then you find the appendix. Okay. Now appendix, you have already read. Cecum, you have already read, and the ileocolic valve. Now you look into the video which I have given you, that how the appendix is being tied and then ligated and cut out. Okay. Now this is the ascending colon, this is the transverse colon, and this is the descending colon. Our gloves, see, this is a kitchen gloves. I had brought to the department earlier when I started the department. Now you can purchase one like this, wash up, and it is, you don't have to throw anything. You keep it in your the locker, or you have put it there or put it in your this thing. Now you carry, or you plastic gloves. I told you 50 rupees, 100. Okay, you can bring it from Amazon or anything. Now this is one. Now kidneys similarly. This kidney is opened, it's cut. Now left side. Wow.
Yes, sir.
Vein, artery,
Ureter.
ureter. Okay. Ureter is in the
Posterior side.
so nature is such, and even the intelligence of human brain. So for previous days or even today, you want to do a nephrolithotomy, stones in the pelvis of the kidney. See, it becomes more or less no major vessel is there. So you cut like this and then go, then you can take out earlier. But nowadays, with endoscopy, you are doing through by endoscope. Okay. Now please see this, and this is the coils of intestine.
Sir, it going to get impression. Sir.
Impression গুলো তো এখানে তো সেভাবে নেই. Now, if you see in the left side, what are the thing? Your visceras. You tell me.
Sir, left side to. Left side is
Our pancreas,
Pancreas
adrenal, crown. You just take it.
Sir.
Now you see stomach also. Your
Sir, the right kidney na?
left
Left kidney. Left की कोई ureter
Ureter
posterior
posterior दिखे থাকে।
posterior रहेगा तो right ही तो होगा।
now this is the stomach.
Stomach.
So you hold it. Yes. This is the mesentery.
Posterior ureter is like the posterior catch. Ureter तो सबसे posterior देखा जाता है। तो कितने स्टूडेंट तो कितने जेडी के जाते हैं राइट में।
Spleen. Hey, ये अविनाश.
Small intestine, sir. Sir, it is small intestine.
It is small intestine. Large intestine. With chora.
With
And this is the mesentery. If you dissect out, you will find the vessels. And here. এবার এক এক করে দেখো, হাতে ফিল করো, বাস ঠিক আছে। হাতাটা রাখো, আর নাহলে একটা ওই কিচেন অ্যাপ্রন নিয়ে আসবি।